The 18 patients discharged from the D Resort Community Care Facility, despite still testing positive for COVID-19, are no longer infectious. The Health Ministry has given this assurance, saying they're clinically very well. The patients were allowed to go home after prolonged stays between 38 and 51 days. They've persistently tested positive on the polymerase chain reaction, or PCR test, because they are shedding dead viral components. We find out more from the head of the National Centre for Infectious Diseases.
Can you explain how this happens? Why are they testing positive but they are no longer infectious?
The PCR can remain for a long time because it is just the detections of fragments of the virus. Viability of the virus, in fact, stopped round about day 10 of the clinical illness. So if we bring this message forward, we are very sure that the individuals, by the time they reach 38, 51 day of clinical illness, they are no longer infectious. PCR represents detection, which is a very sensitive method, picking up genetic fragment of the virus. It does not represent the full presence of the virus, nor does not represent that the virus is still viable. And it's important to make it clear that at this point in time, research in Singapore, as well as research overseas, we can't culture the virus by the time the patients reach day 10 of the clinical illness. And that also corresponds to the amount of PCR that we can detect. In fact, very low by the time they reach 7 days and 10 days of clinical illness. I would say that for these 18 cases, we have established a panel of experts to look at these cases in details in terms of the clinical status of the clinical illness, as well as the overall development of the entire clinical course.
What would you say to the community who may be slightly concerned that, what they're seeing is that the patients are still positive?
It is important for us to understand that they are no longer infectious. They are now back into the community and it's safe to interact with them. I want to also bring back this point to make sure that people understand that the infectiousness starts very early in the clinical illness, and it also has the capacity to transmit even before the symptoms started. So in other words, it's important for us in the community to understand that the pressure or the transmissibility starts very early, and we have pre-symptomatic transmissions, and we cannot let go of the current measures that we put in preventing the community transmissions.
Is there a possibility that they may get the virus again, though?
I think reinfections or even relapse, so to speak, is a things that people has been talking about. But in terms of reinfections, I have not seen any one of them, Singapore, as well as overseas, that can prove the case of reinfection at this point in time. So in summary, there is no clear-cut evidence to prove a case of reinfection as of now.
Will we expect more of such cases in the coming days and weeks?
We will learn more, and as we learn, we will continue to adjust into how we look at the disease and how we manage the patients. I wish them all the best, and I also hope the community can understand that PCR positivity does not equate to infectiousness, and they are no longer infectious. Let's welcome them back into the community.